All right. Welcome, everybody. Welcome. I'm just going to wait another minute or two before we get this started. Now, the chat is open, so tell us, where are you joining in from today? And I'll tell y'all, I'm joining you from Atlanta, Georgia. And give it one more minute. Ooh, hi, call. Yes, yes. Yeah, you won't. Oh, you can't see us? Uh-oh. Susan, you can't see us? Northern California. Do you want to hop back, Susan? Do you want to hop back out and then come back in? Oh, outside of Denver, Central Texas. Oh, Northern California. Okay. All right.
Oh, Tracy.
Okay. All right, everyone. Let's get started. So, welcome to today's webinar, Nutrition Strategies for Managing Comorbidities, Empowering Cancer Patients to Take Control of Their Health. I am Megan Claire Chase, and I am SHARE's Breast Cancer Program Director and host of our BC Life podcast. Plus, I'm also a breast cancer survivor. Now, before the presentation begins, I'd like to tell you a little bit about SHARE for any newbies in the audience. So we're a national nonprofit that supports, educates, and empowers anyone diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. And for more information about upcoming webinars, support groups, podcasts, and our helplines, please visit our website at sharecancersupport.org. Now, we have a few reminders for you, a few housekeeping rules. All participants will be muted during this presentation, and a reminder that the chat is enabled, so feel free to write comments and engage with each other, but make sure that you select in the drop-down box everyone when using the chat. And once Michele finishes presenting and doing the cooking demonstration, which I'm very excited about, that's when we will have our Q&A discussion. So if you have any questions that come up for you, please put them through the Q&A section at the bottom of your screen. And remember that our speaker cannot give specific medical advice, so please keep your questions general. And we did have a slew of questions submitted with registration, so I want to thank you to everyone who submitted those. We also have closed captioning available. You can enable this feature by clicking the live transcript button at the bottom of your screen and selecting the subtitle option. And lastly, this webinar is being recorded, and we'll share this recording in a few weeks with all the registrants, and it'll also be added to our website. So now I would like to hand it over to Michele to introduce herself. Michele, the screen is yours.
Oh my gosh, Megan Claire, your infectious energy is just giving me energy. Thank you so much for that. And thank you to Share for allowing me to speak with your community. I'm very excited. I hope you feel that this is a very informative session, a little bit of the clinical stuff so we can understand what the content is, and then I'll move into nutrition so we can talk a little bit about how we can work through some of those clinical treatments that you are going through, or the comorbidities. So a little bit about myself. I am a senior culinary dietitian with Unite for Her. I am so fortunate to work with 3 other very talented dietitians. So there's a total of 4 of us on our team, and I cannot believe this, but in less than a month, I will be 6 years with Unite for Her. So I started with Unite for Her when we were still local in the Philadelphia tri-state area. Since then, we have gone national. So I also noticed in the chat, I recognize some of our members' names, which is fantastic. That makes me feel so good and just makes it all feel more of like a community. So I work directly with our members to provide nutrition support during treatment and beyond. I live in the suburbs of Philadelphia. So if you're familiar with the area, I'm a little bit northwest of Philadelphia, depending on traffic, 30 to 45 minutes. If you're a history buff, I live right outside of Valley Forge. King of Prussia Mall, second largest mall in America. So that's where I am. I live with my husband. I have a son who's a sophomore in college, a dog, 2 cats, very large fish tank, very large turtle tank. So a lot going on in my world. So that's a little bit about me. And Megan Claire, is it okay to share my screen and get started?
Yes, please.
Excellent. All right, how is that looking for everyone here?
Victoria, can you help? Oh, there we go. Yes, perfect.
Excellent. All right, so let's go ahead and get started. So yes, as Megan Claire mentioned, managing comorbidities throughout the cancer journey. But before I get started, let me go back to Unite for Her. So who are we? We are a national nonprofit supporting breast and ovarian cancer patients in the United States. We are also in the one of the Philadelphia suburbs. We recently moved. We were out in Westchester, Pennsylvania. We are now in Malvern in our new offices. If you are in this part of the country, please stop by. We would love to welcome you into our offices. But a little bit about what Unite for Her does. We bridge the gap between conventional and complementary treatments. So we have 2 programs. The first one is our signature program, where we provide services that are valued at $2,000. So it includes nutrition counseling, 6 weeks of vegetables, meal delivery, yoga, mental health services, fitness memberships. We also have another program, our Empowered Living program, where members have free access to, again, nutrition counseling with one of us dietitians, live cooking demonstrations, guided meditations. We have a lot of speaker series where we tap into experts in the field of nutrition and oncology. So they join us for live events that is welcome to the Empowered Living community as well. And we have recorded functional movement classes. So a little bit for everyone. All programs are free and are available at any stage. For those living with stage 4 or recurrent ovarian, those services we provide to them for life. Okay, so I like to put up an agenda because just so you can start to visualize how the presentation will flow. So the first part, like I had mentioned, we have a little bit of the clinical portion of it, and then we'll talk more about nutrition. So what is a comorbidity? Prevalence and impact. How often do these comorbidities occur? How can that affect a cancer diagnosis? Alcohol and tobacco and its direct relation to a cancer diagnosis. And then we'll transition into nutrition and lifestyle, exploring how to integrate that knowledge into your daily routine. Why nutrition matters. We know it does, but how? Lifestyle upgrades. Upgrade, not an overhaul. Please don't go back and tell your family and friends that this dietitian today told you to change everything, clean out your refrigerator, your pantry. We're just taking small changes that are sustainable. So that's what our practical tips will show you, sustainable changes. So we've been saying comorbidities. Let's change it. Let's call it coexisting, a little bit easier to understand. So coexisting condition, the coexistence of disorder or chronic diseases in addition to cancer. So here are some common conditions of coexisting conditions. Okay, so this is not an all-inclusive list. These are the most common ones, but maybe something else that you're not seeing on your screen, such as IBS or polycystic ovarian syndrome. But you will typically see, and these conditions before cancer diagnosis, during your cancer diagnosis, these conditions may come about. So diabetes, cardiovascular disease. So when we talk about cardiovascular disease, that's the general term of conditions affecting the heart or blood vessels. So it can increase the risk of a heart attack or stroke, depression and anxiety, obesity, lung disease such as COPD, asthma, nutrient deficiencies and malnutrition. So when we're experiencing that, that can affect our bones and our immune system. So a couple interesting studies that I pulled prevalence of coexisting conditions. So one of the studies, cancer patients with coexisting conditions increased from 48.7% to 53% between 2002 and 2018. This was more pronounced among young survivors aged 18 to 44 and adults without cancer history. And I'm willing to bet, because now we're in 2025, that those numbers may have increased a little bit. 77% of patients had at least one chronic condition before diagnosis. 47% had two or more. So what is the impact of having this coexisting condition? Several impacts. So let's break them down. I want to give examples that hopefully will make it a little more clear. So delay of diagnosis. So if you have a coexisting condition, there might be a delay of diagnosis. So a side effect of diabetes may be fatigue, right? So due to loss of sleep or dehydration, and this fatigue from from diabetes can mask early stage of cancer. Say there could also be treatment interactions. So if you're receiving radiation for breast cancer, you may develop radiation-induced heart disease, which can worsen an existing heart condition. Procedure complications. So thinking about a diagnostic procedure such as blood work. Someone with chronic liver disease may naturally have elevated levels of tumor markers, which is also a marker for liver cancer. So it might be difficult to distinguish the cancer-related changes to the liver disease-related fluctuations. Quality of life. Self-explanatory, right? So when you have one chronic disease going on, that's traumatic enough, but now you have something else going on as well, can make it all the more difficult to deal with. Disease severity. A cancer patient with severe kidney disease may have limited chemotherapy options because some of those drugs could perhaps damage the kidneys further. Provider discrepancies. You have this whole team that you are working with. Say your oncologist recommends a chemo regimen, but then you have a cardiologist who is worried about your heart condition, and they might want to prioritize the heart condition first, which could lead to a postponed or weaker cancer treatment. Chronic conditions management. So same thing, you've got this team. So you could have your oncologist, endocrinologist, primary care physician, and they all need to work together to help modify your medications while monitoring your glucose levels. So, if you are put on a steroid, that can increase your blood sugar levels. It's a little bit of a puzzle. Increased side effects. So if you take someone who's prescribed an opioid for pain, maybe they're taking Xanax for their anxiety, these both can cause drowsiness, but now it's excessive and could lead to other side effects because of the combined sedative effects. So maybe a little bit of confusion. Your fatigue is now extreme fatigue. All right. Alcohol and tobacco use. We've heard at least once in our lifetime about how alcohol and tobacco can affect our health. So if you look over here specifically at alcohol, approximately 4% of all cancers are caused by alcohol consumption. It can increase the risk of 6 different types of cancer. And this is any type of alcohol, whether we are indulging in beer or wine or spirit, does not matter the amount, it increases your risk. The IARC, which is the International Agency for Research on Cancer, classifies alcohol as a class 1 carcinogen, which means it has a direct link to cancer. For tobacco, leading cause of preventable cancer. And what that means is that tobacco use contributes to the most cancer cases, but can be avoided or reduced through lifestyle changes. So tobacco is shown to increase 17 different types of cancers. And again, the IARC classifies tobacco as a class 1 carcinogen. So what we like to do at Unite for Her, we provide resources. We have so many resources for everything. Side note, we'd love for you to check out our website for these resources, but I wanted to highlight a few. So remember, I was mentioning that we have experts in the field, and we have what we call a Her Speaker Series. So our Director of Culinary Nutrition and Education, Erin Pellegrin, she presents with speakers. This particular link that I've included, which I believe you will be able to, you will receive after the presentation, is a whole segment on alcohol and breast cancer. So a lot of good information there. We have access to, which of course you can find it online as well, from the Office of the Surgeon General, Alcohol and Cancer Risk. But we also have a blog with numerous mocktail recipes. So a mocktail is a beverage without alcohol that you can enjoy. So when you are at a party or you're out to eat, there are still so many options of fun mocktails where you can enjoy yourself without the alcohol. We have a summer sip series. Matter of fact, we started it last year. We are in the process of creating more recipes for mocktails. I tested a recipe last night, which was amazing. So make sure you check out our blog for these recipes. Also, we partner with zero proof alcohol companies, Ritual, Abstinence. I put their link there. We do partner with them. If you go directly to their websites, they will have other recipes as well. All right, so now here is where we are going to transition over to a spotlight on nutrition, sustainable ways to improve your health. So here's that slide, why nutrition matters. These are just 9 examples right here. There are so many reasons, right, of why our nutrition matters. So it can overall help us feel better. So if you think about if you are having a diet that is rich in plant foods, adequate protein, you're staying hydrated, we're feeling good. But there are times when we have indulged, which is okay. We want to do that, right? We want to enjoy what we eat. But sometimes if we go overboard or if it starts to happen consistently, we might not feel so good. So getting good nutrition is going to make us feel better. It can help us better tolerate treatment. If we are well hydrated, then we are able to feel better help us flush out any type of treatment we may be receiving, helping our kidneys do that. We can get hydrated through food. Um, if our if we're eating better, if we're paying attention to our nutrition, it's boosting our immune system. It's going to help improve our healing. So if we're meeting our protein needs, then that is helping us generate new healthy cells. This is all going to help lower our risk of chronic disease because nutrition can help lower inflammation in our body, which can increase the risk of any type of chronic disease. When we're boosting our immune system through nutrition, this is going to lower our risk of infection. And I'm going to get a little bit more into this. All right, I can talk about nutrition until the sun goes down, but we also like to talk about a total lifestyle, right? We do hear this a lot. It's not just about what you eat, it's looking at our entire life cycle, or excuse me, our lifestyle. So up here, I have nutrition. I'm going to talk a little bit about food, but I also want us to keep in mind that that's just a small piece of the puzzle. Staying hydrated, like I mentioned, is giving our cells energy. It's keeping our joints lubricated. It helps with the brain fog. If you were just a little bit dehydrated, our brain fog could start to set in. Stay active. And it doesn't mean have this full on exercise routine where you're running and you're lifting weights, whatever that means to you. Staying active is very different for everyone. It could be chair yoga. It could be taking walks. It could be training for a 5K. It could be using resistance bands. So the point here is doing what works best for you. Sleep well. 7 to 9 hours of uninterrupted sleep. That's hard for a lot of us, right? Side effects, we may have just had surgery, maybe anxiety, depression going on, or maybe we've just never been a good sleeper. But research shows that getting adequate rest can help reduce the risk of any type of chronic disease. So coming up with a great sleep regimen, we may have heard this too, shutting down electronic devices, your room is at the adequate temperature, maybe some light meditation going on before bedtime, all different things that might be able to help. Take care of yourself. Self-care is not selfish, finding things that make you happy, music, your spirituality, your hobby, spending time with family and friends, whatever you can do, this is all going to contribute to a healthy lifestyle. Okay, our perfect recipe. So here we go. Let's get into some specifics. So as I go through this and talk about different foods, think about what you can add to what you're already doing. So don't look at it as saying, these are the only foods that I can eat. Look at it as, what can I add? So hopefully this is going to spark some inspiration, okay? Plant foods. When we hear plant foods, we think of produce, fruits and vegetables. Plant foods are so much more. Fruits, vegetables, beans, nuts, seeds, whole grains, herbs, and spices. All of these foods have fiber, okay? Fiber contributes to the good bacteria in our digestive tract. We've learned that 70 to 80% of our immune system lies in our digestive tract. So when you're eating all of this good fiber, you're boosting your immune system, you're creating this anti-inflammatory environment in your body. Herbs and spices might be something a little bit different that you may not have experimented with. Maybe you just, salt, pepper, garlic powder. There are so many other types of herbs and spices. Gram for gram, they pack so much more nutrition than all of these foods that I have up here on the screen. Okay. Fruits and vegetables, choose color. All those different colors represent different types of vitamins, minerals, antioxidants. Going back to herbs and spices, they can add color, flavor, texture, especially if maybe you are in treatment and you're experiencing some taste changes or you cannot taste anything at all. Use your herbs and spices to help navigate through that. Lean proteins. So increasing your protein, whether that is through your animal proteins, meat, fish, dairy, poultry, and eggs, or your plant protein, beans, nuts, and seeds. Protein supports muscle recovery and growth. So it could repair tissue that's been damaged through injury or for surgery or from surgery, can help generate new healthy tissue. And from a heart health standpoint, looking at poultry, low fat dairy. So we're trying to decrease our intake of saturated fats. Down here, healthy fats. So again, unsaturated fats, especially our mono unsaturated and poly unsaturated fats, that can help lower our bad cholesterol, which can clog our arteries. So it's funny to hear the term healthy fats and heart health. So there is a difference between saturated fats and unsaturated fats. Brain food, these foods listed here: avocado, nuts and seeds, olive oil, fatty fish. Those include omega-3 fatty acids that can help reduce inflammation in our blood vessels, lowers the risk of plaque buildup, which could lead to heart disease. Those healthy fats can relax blood vessels, improving blood flow and reducing the risk of high blood pressure. Complex carbs, carbohydrates, there's that word, right? Low carb diets, I need to eliminate carbs. That is simply not true. Please remember there are two types of carbs. There are simple carbohydrates. So that could be found in our packaged foods, crunchy, salty, our sweet cookies and cakes and all types of desserts. Not saying you have to completely give those up. Obviously, we need to eat them in moderation, but those simple carbs have added sugar and saturated fat and added sodium. So thinking more about the whole or complex carbs, whole grains, whole grain bread. We'll talk a little bit about a whole grain during my cooking demonstration. Carbohydrates are the preferred source of energy. Our brain, our organs, our central nervous system, they prefer carbohydrates to be that source of energy. Fermented foods, maybe that's something we have not really thought much about, but fermented foods are so important for our gut health. They contain probiotics, vitamins, enzymes that support our gut health, helps with digestion, our immune system, and our mental well-being. There's this whole gut-brain axis where they talk to each other, and it sounds weird to think that your brain has something to do with your immune system, but it is all connected. So yogurt, kefir, which is a fermented milk, kombucha, sauerkraut, miso. So maybe that's a small goal that you can set to try one of these fermented foods into your diet. So let's talk about some sustainable, practical tips for managing nutrition. These are small changes. We are not going to swap out everything. Maybe we're going to try one thing this week. I'm going to try kombucha. I've seen it in the store, never had it. Or maybe I'm going to try one new recipe this week. Maybe I'm going to add a leafy green vegetable 2 times this week. Small goals. Once you've achieved that, then you feel more empowered to try a different goal, right? Keep going, like, okay, I got this. And then you can build on that. Plan your meals does not mean you have to spend a whole day shopping and cleaning and cooking and prepping. Maybe just having a general idea, or think of those few things that you can do. So maybe it's just chopping up some vegetables so you can grab for a snack or add to a salad. Cook a grain and put it in your refrigerator to pull out as a side dish or add to a soup. Cook at home. That's where we can control what is being added to what we are eating. Are we always going to cook at home? No. But for the most part, if you can, then you're that much ahead of the game. And please use our website again for getting some recipes to add to your recipe toolbox. Okay. Mindful eating, eat when you're hungry, stop when you're full. Very, very easy, easier said than done. Okay. But paying attention to those body cues, maybe it's the environment that you're eating in. So trying to maybe just sit and eat without watching TV, not while you're driving, not while you're working on the computer. Those are the moments that we tend to eat more than we realize that we are eating. If we do go overboard sometimes, it's okay. It's going to happen. We need to be flexible with that. So there are things in life that pop up. Maybe you are anxious for something that's coming up and we have some of that stress eating going on. Maybe you have company coming or you're going away for a few days. That's okay. Enjoy and then go back to some of the things that we've talked about. Very important to be gentle with yourself. Okay. So small goals, a little bit of planning, cooking your meals at home, thinking about what you're eating, how you're eating, paying attention to those body cues, and be gentle with yourself. So before I transition down to the kitchen, I hope there were some key takeaways, recognizing those coexisting conditions and their potential impact on your cancer journey during your journey and beyond. Understanding the facts about alcohol and tobacco in connection with a cancer diagnosis, and acknowledging the significance of nutrition and lifestyle and their positive impact during cancer treatment and beyond. Here I have my resources that I pulled some of those good little tidbits from those studies. And before I head downstairs, I just want to show you what I am going to be making. There's a little QR code up there. If you want to scan it, it will throw you on our website. But I also believe that Megan Claire will include that in any follow-up communication. The reason why I picked this recipe, one recipe, it has all those things I was talking about. Fiber, because I've got those plant foods in there. Complex carbohydrates, barley. Lean protein, our tuna fish, healthy fats, avocado, herbs and spices. I'll be using some parsley and salt and pepper. All of that is going to help with our gut health. Okay, so with that, I'm going to stop sharing. And Megan Claire, okay for me to shut down up here and head downstairs?
Yes.
Excellent. So if you want to do a little song and dance while I promise I'll be less than a minute. So here
Yes, everyone, we are so excited to have a live cooking demonstration. So Michele has the camera set up in her kitchen. She will walk us through all of the ingredients. And please know we are seeing your questions coming in. So if you have additional questions, please add them to the Q&A section, but we have captured everything that has been submitted thus far. And we will ask those after we see the demonstration. I'm super excited about this because I am someone who does not like to cook. Yeah, I'm just not one that likes to do that. So this is thrilling. Michele, there you are. Take us through this.
I made it, and I made sure I didn't trip down the steps because then that would have not been good. So, well, welcome. I just feel like I zoomed you into my virtual kitchen. And this is what I meant earlier when I was talking about live cooking demos. So myself and the other dietitians that I work with, we zoom you into our kitchen live. We do 3 recipes. Obviously, I'm just doing a quick recipe today, so we can move on to your questions. But here I am. I'm making this tuna, barley, avocado, tomato salad. I have most of my ingredients prepped right here. So this will be a pretty quick demonstration, but the purpose is to learn a little bit about nutrition and to show you that good nutrition does not have to be difficult. It does not have to be complex. Okay, so let's go ahead and get started. First off, I have grape tomatoes, and depending on the size, you can just slice them in half. If you have cherry tomatoes, if you have beefsteak tomatoes, if you have Roma, it doesn't matter. I am very big on not running out to follow a recipe specifically, each ingredient, unless I have them. So I did not have grape tomatoes, but I had cherry tomatoes. So just cutting them up into bite-sized pieces, whatever works best for you. All right, so there goes my tomato. Next, I have celery. You don't have to just use celery. If you have stuff that's on its last leg, if you have carrots in there, say you have broccoli or cauliflower, dump that in as well. So here I have my celery stalk, just slicing it in half. You don't even have to slice it in half, whatever works best for you, whatever you have time for. I like to say if you're making this for yourself, then you don't have to make perfect cuts. You don't have to be fancy. Maybe if you are having company, you can impress your friends with your dicing skills. Okay, red onion. If you don't have red onion, use white onion, yellow onion, whatever. I like to use purple onion, red onion, because it brings some color out. And also, bonus, whenever we have fruits and vegetables with a color, so think of red, purple, blue, that represents a plant chemical called anthocyanins. Anthocyanins are wonderful antioxidants that are going to help fight the free radicals in our body that could potentially increase the risk of doing damage to our DNA, which could increase the risk of any type of chronic disease. So that's what I mean by eating the rainbow, okay? So a little quick demo on how to dice an onion. Obviously, I had the whole onion. Oh, great, I have it right here. Okay. So I had my onion like this. I sliced it lengthwise. I cut off the top. The stem is that little hairy, furry part. And then what I do is I just take my knife. I don't go all the way to the top. I just start making slices. Be very careful. And then I turn it. And I have this beautiful diced onion. Now, if you are having trouble, neuropathy, any type of bone and joint pain, and this is not working for you, I think the grocery store has done a beautiful job of convenience items. So chopped up onions, peppers, soup starters. So maybe that's something that you would want to do. Okay. So again, I have my tomatoes, diced onion, celery. Next step is to add tuna. I threw the tuna in the refrigerator because I have cats and I didn't want to come down to an empty dish, right? So here I have just some regular tuna packed in water. I'm going to add that. And next, I'm going to add barley. So barley is one of our whole grains, okay? So again, those complex carbohydrates, good for energy, full of fiber, they are filling. If you do not want to purchase barley because you think, I'll try the recipe and then I might not go back to that barley, use a grain that you enjoy. Perhaps that's rice for you, okay? Perhaps that's quinoa. If you want to try quinoa, any type of grain dish is versatile because you can change them in and out. All right, next I'm going to add some parsley. If you don't have fresh parsley, some of us do not like to buy fresh herbs because you'll use a sprig of it and then you'll find it 2 months later, right? So if you are going to use your parsley, then purchase it fresh. If you'd rather buy a dried herb, that's okay too. You can use cilantro. I like to cut my stems, just gives me some added nutrition. Again, because I'm by myself, I don't know if I was having company, if I, would add my stems for fear of it hanging out of their mouth or my mouth, but I love the stems. Add some nice, add some extra flavor and texture. Okay. Avocado. If you're not a fan of avocado, don't worry, this will not make or break your recipe. So cut my avocado in half, remove the seed. I will not do that on camera either because that could be a challenge and it could go flying across the room, right? So I'm just putting little scores in. This is a very ripe avocado. We have videos on our website that show you how to pick the perfect avocado. So we have a lot of resources out there. All right, so I have my salad ready. Let's quickly whip up this dressing. Okay, so I am using olive oil. You could use avocado oil if you would like, whatever you have on hand. I have some lemon juice. I think lime juice would work well, and a little bit of white vinegar. Any type of vinegar is fine. Apple cider vinegar, red wine vinegar, balsamic vinegar. The sky is the limit. Some salt and pepper. Add what other herbs and spices you would like. Give it a good whisk. And I'm just going to pour that in. Give it a good mix. Oh, it smells so good. And so dinner, lunch, afternoon, snack, this is something that I will not be able to finish on my own, clearly, but it might be something that I would have for lunch and then maybe a snack. I would say this serves 2 to 4 people, depending on what you are, how you're serving it. And here, we serve this so you can see how beautiful this looks. Add my avocado. Since my avocado was a little bit on the soft side, I did not mix it so it wouldn't turn into guacamole. I wouldn't mind if it turned into guacamole, but okay. There you go. So you have this beautiful, quick, easy green salad. So again, barley, tuna, some vegetables, have the pretty green, purple, red. There you have it. If you live in the area, you can come over and enjoy that with me. So I hope you found that simple and easy to do. Any questions about the recipe before we move on to any other questions?
I just have one observation. I didn't know there were that many types of vinegar. I'm like saying, what?
I know. And I know there are, and I'm sure, rice vinegar, I forgot to mention that also, so many different types of vinegars out there on the market. If I had no vinegar, I probably had distilled vinegar in, somewhere, because sometimes I'll clean with that. I would have poured that on top too, but I just saw the question about the measurements, so it will be in the recipe, but I actually have the recipe right here. So it was 2 tablespoons of olive oil, 1 tablespoon of fresh lemon juice, 1 teaspoon of white vinegar. And taste it, adjust it. If you wanted a little bit of sweet, you could add a little bit of honey, maybe a drizzle of honey to that. for when you see recipes that say fresh lemon juice, fresh lime juice, if you'd rather just use the bottle, again, sometimes squeezing our own citrus fruits can be a little bit challenging. So just buy the cute little, the little lemon and lime containers, or buy yourself a large bottle. So yeah, but change it up. Try it with lime juice as well.
Well, thank you so much, Michelle. It does look delicious. So a couple of questions that kind of like go into even what you just made. So, what are some strategies for incorporating more vegetables to meals, especially for those who struggle with taste and texture, and then take that a step further for those that have difficulty eating raw vegetables and salads? Like, what are some alternatives to get those nutrients?
Yeah, that's such a great question, and a common question, of course. So everything that I mentioned today, even though full of color, full of fire, it's not going to work for all of us. Okay, so we're all having different challenges, or things that we're not tolerating. So for what, first and foremost, if it's anything GI related, if it's raw, um, it might be helpful to try to find the trigger first, to make sure that maybe it's just the one thing that you need to put aside. So making a mental note, or keeping a little bit for a couple days, a food diary. So, okay, I did have the onion in that earlier in the day, and I felt it an hour later. So that's number one. Just be mindful. It's so hard to say that this is the cause, that's the cause, because everyone's different. So a strategy to get more into your day would be to maybe think about your breakfast. If you typically have oatmeal or yogurt, maybe one day or 2 days, try some eggs, a scrambled egg or an omelet, or, fry an egg, and then have a side of spinach with it, or mix it into the eggs. If you were to have an omelet, add some mushrooms, that type of thing. It doesn't have to be this full on beautiful omelet that you see, but even if it's one vegetable that you can throw in your omelet, that's one strategy. The parsley that I used, if you were to make a bean dip or hummus, or if you have pre-made hummus, why not swirl some chopped parsley in there? So you're getting a little bit of an extra nugget of nutrition. If you are having a salad, and you typically do, um, in a salad, we might have carrots and we might have onion, just be mindful of thinking, what else do I have in the refrigerator? And we get this tunnel vision. Or you have frozen vegetables. So maybe you are preparing something for dinner, you have a soup, you have your recipe for the soup, it tells you what you need to include. Oh, wait, I have some frozen peas in there. So that's another strategy of really like thinking about it. It's not always going to be perfect, because you might not always be feeling well. And that's what goes back to being a little bit gentle with yourself. Capitalize on the moments when you are feeling like, yeah, I think I can try this new vegetable, or I think I can add another plant food. But yeah, that was a long-winded answer to that question, but it sparked up so many things that we hear from our community. But go slow too. Go slow with thinking about adding vegetables. Vegetables can be a little bit of a challenging when you're new to getting them in, and where do you fit them in. And we can always help with that. Speak to your dietitian. If you're already a member of Unite for Her, speak with us, and we'd be happy to tailor that for you.
And what about those who with nuts? Like, who, what is it that they, where's my question here? Yeah, that they with salads, and like, because I've actually noticed I'm having difficulty digesting
Mhm.
like mixed greens for salads. I was like, when did that happen?
Yeah.
Should we, like, what are some ways to also like do we increase like nuts and seeds? Like what are some other like substitutions for those who can't really digest
Yeah.
salad anymore?
And I'm glad you brought that up too. I was thinking about it when we were from the last question too. So maybe it's the way it's prepared. So yeah, maybe raw broccoli, raw spinach. It's, that's making your digestive tract work work hard, right? And that's what we typically say: eat all that fiber. It's good for our digestive tract. It's pushing everything through. But there are times where maybe it's cooked spinach, steamed broccoli, or even fruit, applesauce or baking a pear. That is, you're getting your fiber, you're getting your vitamins and minerals. It's just in a different form, and that's okay. So if right now you're not tolerating nuts and seeds, that's okay. Find something else. So, and that's a question that comes up a lot too. What type of beans should I be eating? Whatever works best for you. If it feels good for you, great. If not, get your plant protein and fiber from something else. Instead of beans or instead of nuts, maybe beans works better for you. Don't eat something because it's healthy. There are other things that you can do that work best for you to capture all of those nutrients that I've been talking about.
Awesome. So can you provide some examples of fatty fish that are rich in omega-3s?
Absolutely. So omega-3s can be a tough one. It's not in all of our foods. So any type of fatty fish like salmon, tuna, mackerel, omega-3s are also, if you're probably like, oh, great, well, I'm not a fish eater. That's okay. Don't eat fish because it has omega-3s. You can also get it through chia and flax seeds. You can also get it through walnuts as well. So there's other ways to try to capture those omega-3s that can help with inflammation and brain health.
So another question is for those who are unable to cook regularly or really can't cook, what are some practical ways to maintain, a varied yet nutritious diet?
Yeah, that's tough, right? That's a great question. It's very tough, and it depends on your situation too. If you have the means to do meal delivery, so you can have meals delivered. There's so many different types of meal delivery services. Unite for Her partners with Sunbasket. There's Purple Carrot, Blue Apron. There's all those different companies that will send you meals that can help you, right? But that might be just for a few meals or a few days of the week. Um, Maybe if you have a support system, maybe someone can come over a couple times a week just to help you prepare things that all you have to do is grab and throw in the pot or throw in the oven. So finding little things to make it simple might make all of the difference. Or maybe you, if you are feeling well, or have someone come and do big batch cooking,
Hmm.
soups or stews or chili, and freeze them, put them into different containers and freeze them. That way you can just pull them out and defrost them and enjoy them. If you have friends and families that are perhaps they have a meal train going for you, they want to help you. It's okay to tell them what you would prefer. I hear a lot of times, oh, I have a meal train, but I'm just not, my stomach is just not tolerating that, or the food is just so heavy. Well-meaning friends and family members, right? But why not give them a list like, hey, I'm looking for some grain salads or just some plain chicken, as opposed to maybe like a ziti or something that's on the heavier side. So remember too that good nutrition does not have to be following a big recipe. It could be something simple like making a tuna sandwich, but then adding some lettuce, tomato, some mustard. So you're still getting all that nutrition without having to dirty up your kitchen or following a recipe that's 15 ingredients.
Gotcha. So we're gonna get back to fish here.
Yeah.
Like, if you enjoy fish, I know I'm a fish eater myself. Like, do you need to limit that number of times that you eat fish per week for fear of, mercury concerns?
Mercury. Yeah, there are definitely some recommendations of how many servings of fish we should be getting per week. I would probably have to double check this, but I believe it's like 2 to 3 servings. And a serving could be like 3 to 5 ounces. But there's also fish that are lower on the mercury scale. So there are resources out there that you can look at to see where that fish that you would like to enjoy, where that falls on the high, low mercury spectrum. So yes, it is something to be mindful of, but not to be scared of because there are ways to go about it safely.
And is tuna in water better or tuna in oil? I'm assuming water, but why did they have tuna in oil?
Yeah, so tuna in water is what I use today. Tuna in oil is just being mindful again of the percentage of fat that you are going to consume per day. So if you're looking to decrease that, then maybe have it packed in water. Sometimes if you're making a recipe though, that oil in the packet might lend to it. I think this would work well in this recipe, but if you're just making it for a sandwich, I would say tuna packed in water would be fine. I'm testing a recipe now that it's sun-dried tomatoes packed in oil. That's what the recipe specifies. So I'm using that oil to give more flavor. So I guess it's a situational question.
Okay. Um, let's see. Okay, are there any diet programs or apps that you personally recommend, Weight Watchers, Noom, or what have you? And how do they compare in terms of like effectiveness and sustainability?
That's the key right there, sustainability. So if you were to follow a plan, you have to make sure it's sustainable for you. Myself and my colleagues, we don't hand out meal plans because what I recommend for you, I don't know if you like half a cup of oatmeal, or maybe you do. Maybe I do get some ideas and I construct it, or the companies that you're working with, they construct something for you. Is that sustainable? Can you afford it? Maybe they're recommending high priced cuts of meat. Do you have the room to store it? If you're starting to gather everything that they are asking, is that something that maybe you live in a rural area? Do you have access to it? So is it sustainable? Will you get bored of it? Gosh, I'm tired of eating oatmeal for the 4th time this week. So, however, if you need some general guidance of just, starting at ground zero and learning about how to put together meals, then by all means, that's great. And then again, from affordability standpoint, those do cost money, participating in those programs. So there's a lot of different things to take a look at. But if that's something that you can include, just think about it as, do I want to continue to eat this way? And you might, and that's great. So it might be more of a meal planning thing when you list kind of, what your typical breakfast foods are, lunch, dinner, maybe mix and match, maybe go online and say quick breakfast or, weeknight dinner, and then you can start putting together your own plan.
Hmm. So I want to make sure I get to this question, and I don't know if you'll be able to answer it, but does Unite for Her have any plans to expand its support services to include the other gynecologic cancers beyond ovarian?
Yeah, I am not sure about that. Just in my little nutrition team world, I'm sure there's always that conversation, but yeah, gosh, we hope so, right? We
Mhm.
hope so, but I don't know the answer to that.
So I just want to make sure I got that. So whoever
Yeah, no,
submitted
I'm
that, we
glad.
got it.
Yeah, but it's, and even the important thing to note too is, going to our website and checking out our events calendar. You Everyone's invited to those events. You can join my cooking demos or the other dietitians cooking demos. So even though it might not be specific to a certain type of cancer, there are still resources that we would love for you to join and engage with us.
Well, thank you so much. It's like I had one last question, but we're already at time. I'm just going to ask it anyway. There we go.
Anywhere?
Right, okay. Can you break down the science behind popular diet trends like keto, intermittent fasting, glucose regulation, plant-based eating? Like, what are those pros and cons?
Yeah, that's a gosh, we could like meet
It's a
again next
doozy,
week, right?
right? That was a doozy.
But I'll give you the cliff note answer to that. So there's pros and cons, right? And the first question would be why? Why would you like to try that? Are you looking for weight loss? Are you looking to increase the amount of plants into your diet? And then comes the whole conversation about sustainability. So if you were to do the keto diet, make sure you're still getting fiber because that's a heavy animal protein diet. You still need to get your fiber. If you're doing intermittent fasting, what's the reason for that? You will be eating in a smaller window. Is that just to cut calories or is that to help with digestive issues? Intermittent fasting could be good for that. Does that fit in with your lifestyle? Our mission at Unite for Her is to talk mostly about a plant forward diet. Does not mean go vegan or vegetarian, not necessary unless you want to, but getting as much fiber from your plant foods in addition to those lean animal proteins for protein, that seems to be where all roads lead to that when you look at the research.
Interesting. Well, Michele, thank you so, so much for your time, expertise. My eyes were kind of watering when I was seeing you cutting that onion. But we really appreciate
I have to say something funny, Megan, because I
yeah.
actually wanted to say it. My colleague Erin, she actually might have hopped in. She bought for her cooking demos like wraparound goggles for when she cuts onions. It doesn't bother me for some reason on cooking, knock on wood, right? My next cooking demo, I'll have makeup. But it's funny that you said that. So yes, that is a concern. A concern.
Oh my goodness. Well, again, thank you. And thank you to everyone who joined us this
Thank
afternoon.
you.
We will have a recording of this program available on our website in about 1 to 2 weeks. And so please make sure to check Share's website for any other upcoming educational programs, podcast episodes. We have our one that just came out, support groups. And also don't forget, follow us on social media, and you can always, email us too if you have, ideas. And also take a moment to complete the survey. These are anonymous, and it'll pop up as soon as we close this out. And we read all of those, and that's how we get a lot of the topic ideas. So everyone, this concludes the webinar. Thank you again, Michele. Thank you, Unite for Her, Share's partner. We love Unite for Her, and I hope everyone has a great rest of the week.
Thank you.